Your kidneys do not fail overnight. They are being destroyed every single day by what you eat. And the most dangerous part is this: you are consuming it daily without even realizing it. If you are over 40, you need to stop and listen carefully. I'm Dr. Michael Carter, a kidney specialist, and I want to tell you something most people only discover when it is already too late. Kidney damage is not loud. It does not come with sharp pain or obvious warning signs. It happens quietly in the background of your everyday life while you continue eating the same foods, following the same habits, and assuming everything is fine. That is exactly why it is so dangerous. Because while you feel normal, your kidneys may already be under constant pressure. Day after day, they are forced to filter toxins, balance fluids, and keep your body stable. And every small mistake you repeat adds another layer of damage. I have seen too many people walk into my office believing they were healthy. No major symptoms, no serious concerns. And then suddenly they are facing a diagnosis they never expected: chronic kidney disease. At that moment, the same question always comes up: how did this happen? And the truth is uncomfortable. It was not one big mistake. It was a series of small everyday choices that slowly damaged their kidneys over time. Things they trusted, things they used every day, things no one ever clearly warned them about. That is why this matters. Today I am going to show you 5 hidden threats that could be damaging your kidneys right now. These are not rare or extreme dangers. They are part of your daily routine, your meals, your lifestyle. And the most alarming part is this: you have most likely exposed yourself to them today. But here is the good news. Once you understand what is happening, you can stop the damage. You can protect your kidneys, and you can change the direction of your health before it reaches a point where there is no turning back. So stay with me, because what you are about to hear could change the way you look at your daily habits forever. Before we move into the list, you need to understand one critical truth. Your kidneys are silent workers. They function every single minute of your life, filtering your blood, removing weight, balancing fluids, and regulating your blood pressure. They are one of the most important systems keeping you alive, yet most people never think about them until something goes wrong. And that is the problem. Because when your kidneys start to struggle, they do not send clear warning signs. There is no sharp pain that forces you to stop. No obvious signal that something is failing. The damage builds slowly over years, sometimes decades, until one day the symptoms finally appear: fatigue, swelling, weakness. And by then, the damage can already be severe. Think of your kidneys like a highly advanced filtration system that never stops running. Now imagine putting that system under stress every single day. Not enough to break it immediately, but enough to slowly wear it down over time. That is exactly what most people are doing without realizing it. And now let's talk about one of the most overlooked dangers: poison number 5, painkillers. This is something almost everyone has in their home. You take it for a headache, back pain, joint pain, or just general discomfort. It feels harmless, especially because you can buy it without a prescription, but that is where the danger begins. Medications like ibuprofen, naproxen, and similar anti-inflammatory drugs can quietly reduce the blood flow to your kidneys. Your kidneys depend on a steady, healthy flow of blood to function properly. When that flow is reduced even slightly, it puts them under stress. Taking one pill occasionally is not the problem. The real danger comes from repeated use. Day after day, week after week, many people, especially as they get older, start relying on these medications to manage chronic pain. It becomes part of their routine, something they no longer question. But over time, this habit can slowly damage the tiny filtering units inside the kidneys. The effect is not immediate. You will not feel it happening, but the damage is real and it accumulates. I have seen patients who thought they were simply managing pain, only to discover later that their kidney function had been declining for years. So, what should you do? First, stop treating pain as something to silence without understanding it. Pain is a signal. It is your body telling you something is wrong. Second, avoid using these medications daily unless it is absolutely necessary and supervised by a medical professional. And third, explore alternatives whenever possible. Simple approaches like physical therapy, stretching, or even rest can often reduce the need for constant medication. Because when it comes to your kidneys, what feels like a small habit today can become a serious problem tomorrow. Now let's move to the next threat. Poison number 4. A sedentary lifestyle. This is not something you eat, it is something you stop doing. Movement. You might be wondering, what does sitting have to do with your kidneys? The answer is more than you think. Your kidneys depend on healthy blood flow to function properly. Think of your circulation like a flowing river. When the water moves strongly, it stays clean and active. But when the water becomes still, everything begins to stagnate. That is exactly what happens inside your body when you spend hours sitting. When you move, your heart pumps more efficiently. Blood flows with strength through your entire body, reaching the tiny filtering units inside your kidneys. This keeps them active, nourished, and functioning properly, but when you remain inactive for long periods, blood flow slows down. It becomes less efficient, and over time, this creates the perfect conditions for serious problems. Weight gain, high blood pressure, type 2 diabetes. All of these are directly linked to reduced kidney function, and the dangerous part is how normal this has become. Sitting for hours in front of a screen, watching television, scrolling on your phone. Many people spend most of their day barely moving without realizing the long-term impact. So, what is the solution? You do not need extreme workouts or complicated routines. You just need to move. Start simple. Stand up every hour. Walk around your home. Stretch your body. Even a few minutes of movement can reactivate your circulation, then build from there. A short daily walk. 10 minutes at first, then 15, then 20. Consistency matters more than intensity. Every step you take improves blood flow, and every improvement in blood flow supports your kidneys. Now, let's move to something even more overlooked. Poison number 3. Dehydration. This is one of the most underestimated threats to kidney health because most people believe they drink enough water, but in reality, many do not. Your kidneys rely on water to do their job. Without enough fluid, they cannot effectively remove toxins from your body. Waste begins to concentrate, the filtering process becomes harder, and over time, this puts significant strain on your kidneys. Think of it like trying to clean something without enough water. Everything becomes thicker, harder to move, and more difficult to remove. That is exactly what happens inside your body. And here is what makes it even more dangerous. As you get older, your sense of thirst decreases. You may not feel thirsty even when your body needs water, so you drink less without realizing the impact. Day after day, this creates a silent form of stress on your kidneys. So what can you do? First, do not wait until you feel thirsty. Make hydration a habit. Drink water consistently throughout the day. Second, pay attention to simple signals. The color of your urine can tell you a lot. Darker color often means you need more water. And third, replace sugary drinks with water whenever possible. This not only improves hydration, but also reduces another major risk factor we will discuss next, because sometimes the damage to your kidneys does not come from what you add. It comes from what you are missing. Now we are moving into the most dangerous part. Poison number 2. Sugar and refined carbohydrates. This is where things start to become truly destructive, because sugar does not just attack your body in one way. It attacks from multiple directions at the same time. Every time you consume sugary foods or refined carbohydrates like white bread pastries or sweet drinks, your blood sugar rises rapidly. Your body responds by releasing insulin to control it. But when this happens every single day, your cells begin to resist that insulin. And that is how type 2 diabetes begins. Diabetes is the leading cause of kidney failure worldwide. When sugar remains high in your bloodstream, it damages the delicate filtering structures inside your kidneys. Over time, these filters become thick, stiff, and less effective. The process is slow, but it is relentless, and that is only the first layer of damage. A high sugar diet also increases inflammation inside your body. This chronic low level inflammation damages your blood vessels, including the tiny ones inside your kidneys. At the same time, excess sugar is converted into fat. This leads to weight gain, which puts even more pressure on your kidneys and increases the risk of high blood pressure. So, this is not a single problem, it is a chain reaction, one habit triggering multiple forms of damage at once. And the most dangerous part is how normal it has become. Sugary drinks, processed snacks, hidden sugars in foods you would never expect. Many people are consuming far more sugar than they realize. So, what can you do? Start by eliminating the most obvious sources. Sugary drinks are one of the biggest contributors. Replace them with water. Then pay attention to labels. Sugar appears under many different names, and it is often hidden in processed foods. And most importantly, shift toward real whole foods, fruits, vegetables, whole grains, and natural ingredients that your body can actually process properly. Because when you reduce sugar, you are not just helping your kidneys, you are protecting your entire body. And now we come to the most underestimated threat of all. Poison number one, salt. This might surprise you. Most people believe sugar is the worst. But in many cases, salt is the silent force that accelerates kidney damage every single day. Not just the salt you add to your food, the hidden salt. It is everywhere, in packaged foods, in bread, in sauces, in processed meals, even in foods that do not taste salty. And this is where the real danger lies. Too much sodium in your body forces it to retain water. This increases the volume of blood in your bloodstream, which raises your blood pressure. And high blood pressure is one of the most direct causes of kidney damage. Your kidneys are made up of tiny, delicate filtering vessels. They are not designed to handle constant high pressure. Imagine forcing water through a fragile filter at extreme pressure every single day. Eventually, it breaks. That is exactly what happens inside your kidneys. Day after day, elevated blood pressure damages these filters, causing scarring and reducing their ability to function. And the worst part is that this process is completely silent. You may not feel it happening at all. So, what can you do? First, become aware of hidden sodium. Start reading labels. You will quickly realize how much salt is in everyday foods. Second, cook more meals at home. This gives you full control over what you consume. And third, use natural flavors instead of relying on salt. Herbs, spices, lemon, and simple ingredients can completely transform your meals without damaging your health. Because when it comes to your kidneys, salt is not just a seasoning. It is a slow, consistent source of pressure that never stops. We have covered a lot today. 5 hidden threats that may be damaging your kidneys every single day. Painkillers that seem harmless but slowly reduce blood flow. A sedentary lifestyle that weakens your circulation. Dehydration that makes it harder for your body to remove toxins. Sugar and refined carbohydrates that trigger a chain reaction of damage. And salt quietly increasing pressure inside your body without you even noticing. Now, I want to share something personal with you. After years of working with patients, I have come to one simple conclusion. Most people do not lose their health because of one big mistake. They lose it because of small habits they repeat every single day without questioning them. And what concerns me the most is this. Many of these habits feel normal. They feel safe. They feel harmless. Until one day, they are not. That is why awareness matters so much. Not to scare you, but to give you control. Because the truth is, your kidneys are incredibly resilient. They can handle a lot. But they are not invincible, and once the damage reaches a certain point, it becomes very difficult to reverse. So the goal is not perfection. The goal is to become more conscious of what you do every day. Drink more water, move your body, pay attention to what you eat, question the habits you have never questioned before. These small actions, repeated over time, can make a powerful difference. But I also want to be clear about something important. This video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Every person is different. Your health condition, your medications, and your risks are unique to you. So if you have concerns about your kidneys or your health, please speak directly with a qualified healthcare professional who can guide you based on your specific situation. If this message made you think, or if you recognized some of these habits in your own life, do not ignore it. Share this with someone you care about, because many people are making these mistakes without even realizing it. And if you want more clear and practical guidance to protect your health, make sure you subscribe and stay connected. Now, I want to hear from you. What surprised you the most? Which of these habits do you see in your daily life? Leave a comment and share your thoughts, because awareness is where change begins. And today, you have already taken the first step.